Hi everyone, welcome to Plexus Ortho. My name is Dr. Kannan Kumar. I am an orthopedic consultant at Bangalore. Today we're going to discuss one of those questions that we put up in the Telegram channel earlier today. The question goes like this. The question was, which gene mutation is involved in the condition depicted in this picture? So in this picture you can see the knee X-ray close to maturity because the physeal line or the growth line can still be seen. There are multiple osteochondromas you can see here, multiple growths which I can see here, 1, 2, 3, is 4 here, 5 and 6, probably there are 10 or 15 only around the knee joint. So what are these outgrowths? They are osteochondromas. There are two types of osteochondromas we know of, stalk or pedunculated and broad-based uh, osteosarcoma. So this is a broad-based osteosarcoma. This is a pedunculated with a stalk-like connection between these. So what is the most common benign bone tumor that we know of? It is osteochondroma. Multiple hereditary osteochondromas are less common, but they are seen quite commonly in the general population. So which gene is involved in multiple hereditary osteochondromas? It is EXT1 gene. So this is a two-step question. You have to first find out what the condition is. Now we have found what the condition it is, multiple hereditary exhastosis. And the gene involved is EXT1 gene. A lot of people got this answer correct in the Telegram channel, so I'm very happy about it. It's not an easy question, it's a difficult question, and a lot of you got it right. So the answer to this question is option number 2, EXT1 gene. Let's go into a little bit of detail about multiple hereditary exhastosis. We know that the most common benign tumor in the body is osteochondroma or exhastosis. But if there are multiple exhastosis, it is called as multiple hereditary exhastosis. There's a hereditary or a genetic association with it, and it is usually transmitted in autosomal dominant fashion. The genes involved are EXT1, 2, and 3 genes. EXT1 gene is the most commonly involved in the severe form of this disease. The X-ray we saw previously is probably the severe form of the disease and therefore most likely to involve EXT1 gene. There is decreased production of heparan sulfate when EXT1 gene is affected, and this causes a problem and causes outgrowth of these benign tumors. They have a cartilaginous cap, so the X-ray will look much smaller than the swelling actually. So the cartilage is much thicker than the bone itself. About 30% of the outgrowth is about cartilage. Therefore, these can be better appreciated in MRI. The cartilaginous cap can be appreciated better in MRI. What is the rate of transformation, malignant transformation of osteochondroma or solitary osteochondroma? A solitary osteochondroma can undergo malignant transformation to chondrosarcoma in less than 1% of cases. However, if it is a multiple hereditary exhastosis, there is a chance of malignant transformation. The chance is 5 to 10% to chondrosarcoma. You must remember this. So less than 1% in solitary and osteochondroma, 5 to 10% in chondrosarcoma. Now, which condition has 100% chance of conversion to malignancy? It is Maffucci's syndrome or Maffucci's disease. Maffucci's disease has more than or has 100% chance of malignancy. Now let's go to a few conditions, orthopedic conditions where mutations are associated, which you should remember. Of course, you would learn these in pathology and other subjects, but a few conditions. This is not an exhaustive list. You must remember these few conditions for your exam purposes. So achondroplasia, all of you know, is the most common form of dwarfism, which has a mutation of FGFR2. Apert syndrome is a syndactyly of the fingers with craniofacial abnormalities and mental abnormalities. Apert syndrome has a FGFR3 mutation. Charcot-Marie tooth disease, Charcot-Marie CMT disease, where you have decreased sensation, deformities in the foot, mostly in the foot, can happen in the upper limb as well, has a mutation of PMP22 mutation, which is a defect in the myelination process. Then you have pseudoachondroplasia, which causes COMP mutation, which is a cartilage formation, causes a problem with cartilage formation. Then you know quite a bit about osteogenesis imperfecta. It is inherited in various forms, autosomal dominant, autosomal recessive, X-linked recessive. So it has various forms of inheritance pattern, and the most common mutation is in the formation of type 1 collagen. Then we all know about cleidocranial dysplasia. Cleidocranial dysplasia is a problem in the clavicle and other bone or intramembranous bone formation. This is because of a mutation in RUNX2 gene. So these are some of the Mutations that occur with orthopedic conditions. You must remember these conditions. They have been asked frequently in exam, and they can be tested in the future as well. So thanks for listening to us. My name is Dr. Kannan Kumar, and we are from Plexus Ortho. Please go ahead and look at our other videos, and I'm sure you will benefit from it. Thank you very much.